Welcome to PregnancyChat.com and to week 31 of your pregnancy. I'm Monica Healy. Let's start off by seeing what is happening with baby this week. This week, your baby is actually just a bit smaller than this pineapple. Your pineapple is approximately 16 inches, 40.6 centimeters long, and just over 3 pounds in weight, 1.5 kilograms. Please remember these sizes are just guidelines, as all babies are a little different because parents come in all different sizes too. Babies will gain weight at a rate of about 250 grams or 9 ounces per week. As she grows, you may be feeling stronger and stronger movements, perhaps adding to your inability to sleep at night. Movement is a great sign that she is thriving inside your uterus, and you may notice more defined and more pronounced rhythms of wakefulness and sleep as she begins to experience REM sleep. Baby's cerebral cortex has now matured enough to support consciousness, and your baby is capable of feeling and remembering. The cerebral cortex is the layer of the brain we often refer to as gray matter. It is the outer portion of the brain. Her brain and nerves are continuing to develop, especially baby's brain connections. She'll have trillions of brain connections before she is born. Inside the womb, she is perceiving all 5 senses and processing information from her environment. Your baby's eyes are opening and closing, blinking and learning to focus, since the pupils are able to contract and dilate in response to differences in light filtering through the wall of the womb. The fingernails reach the end of the tip of the fingers now, but the toenails still need a little more time. Your baby is more aware and feels your uterus massaging him when you have those Braxton Hicks contractions I've previously described. Baby is making faces, hiccuping, swallowing, breathing, pushing the little hands and feet along the uterine wall, and even sucking his or her thumb. If baby hears a noise, he may react with a kick. Your baby's reproduction system is continuing to develop. If your baby is a boy, his testicles are moving from their location near the kidneys in the abdomen through the groin on their way into the scrotum. Although I have seen on an ultrasound testes within the scrotum long before this week. If your baby is a girl, her clitoris is now relatively prominent. However, her labia are still small and don't quite cover it yet. Although your baby's lungs are now more developed, they are not truly mature. If baby was born now at this stage, would likely need a ventilator to help breathe. So what's happening with you this week? 30 weeks down and only about 10 weeks to go. You're probably feeling the effects of the 3rd trimester, and if nothing else, your rapidly growing belly is certainly weighing you down. Although moderate exercise remains important, be sure to take it easy when necessary. This is a great time for you to receive plenty of rest and relaxation before the arrival of baby. In fact, any new mom would probably advise you to enjoy it while it lasts. Symptoms, and more symptoms. Although you may not be experiencing new signs of pregnancy, some old symptoms are becoming a bit more glaring than others, such as absent-mindedness. Sure, baby may be getting smarter, but you may be seemingly more and more scatterbrained these days. It is perfectly normal to misplace your keys, forget what you needed at the grocery store, or even search for sunglasses that are already on your head. There's a lot on your mind. Make life a bit easier by staying as organized as possible. As baby grows larger and quarters become cramped, there is less room for your lungs to expand as you breathe, causing a feeling of breathlessness. Try to find positions in which you can comfortably take breaths, such as standing or lying on your left side. Your bladder is also feeling the pressure, and you are probably running to the bathroom more often these days. You may also be experiencing constipation and hemorrhoids. Taking regular exercise, eating high fiber foods such as cereals and whole grain bread, and drinking plenty of water can help relieve the problem. Check out our nutrition video for more detailed suggestions. You might feel a tightening in the abdomen that lasts approximately 30 seconds before relaxing again. These are Braxton Hicks contractions. This is your body preparing for the delivery of that bundle of joy that you've been toting around all these months. These contractions should be infrequent and inconsistent. However, if they begin to occur frequently, 5 or more in an hour, call your practitioner. It could be a sign of preterm labor. With your belly expanding by day, Backaches as well as other aches and pains throughout your body, abdomen, hips, even legs are quite common. Take some time to stretch or even enroll in a prenatal yoga or Pilates class to alleviate some of the discomfort. Okay, my tips for this week. If you're having a boy and are considering circumcision, it may be a good time to research the procedure as well as the pros and cons. If you're developing varicose veins, buy some support hose, and for maximum relief, put them on before you get out of bed in the morning. Rest with your feet up whenever you can, as this helps the blood drain back to your heart. Take brisk walks because muscles help pump the blood back to your heart as well. If you have to stand for long periods of time, keep shifting your weight from one leg to the other instead of standing equally on both. And lastly, keep check on your weight gain because carrying extra weight will put even more pressure on your legs.